Here are 15 danger signs that can occur during pregnancy that you should know about. Every pregnant mother needs to know about these ones. The first one is bleeding during pregnancy, vaginal bleeding. Whichever kind of bleeding, whether it is light bleeding or heavy bleeding, please, it is not a normal sign during pregnancy. No fetal movement or excessive fetal movement after you've had your first baby kicks or your first baby movement is another danger sign. It could be a sign that you're losing your pregnancy, or it could be that your child is in distress. So do not give that a deaf ear. Excessive headaches that are prolonged or with long-standing, please, it is not a sign that you should just stay at home. Please go get checked once you get those headaches. Severe abdominal pain that can either be as mild as your period cramps or even much more than that. Anything that is severe in your abdominal pain, especially the lower abdomen, please do not withstand that pain. It is something that you need to rush urgently to your healthcare provider. At whichever stage, even if you're in the last trimester, breaking of your water is an emergency. That means your baby is almost here, or there could be something that could be causing that. So please do not assume it. Do not see any liquid getting out of your vagina and you're just seated there comfortably. It is a danger sign that you shouldn't sit on. Most of us know that nausea and vomiting is part of pregnancy, but if it is excess and you are vomiting everything that you're taking in, please go to your healthcare provider. It could be hyperemesis gravidarum, which is a very deadly symptom in pregnancy that you shouldn't just assume. Anything above 38.5 degrees Celsius of your body temperature, please rush to the hospital. It could be an infection that is developing. It could be preterm labor. It could be a lot of things. So please do not assume fever or chills when you are pregnant. Swollen feet and hands. Did you know that some of us have taken that as, it is edema that comes with pregnancy, but swollen feet and hands and sometimes your face is not something that you should take lightly. It could be hypertension. It could be preeclampsia in your pregnancy. So please do not take that as a normal sign for pregnancy. Any sign that shows swelling on your body, please rush to your healthcare provider. Itchy feet and itchy hands. Do you know that sometimes your liver could fail, and that could be another thing that could point to that? So please, if you have any burning sensations in your feet and in your hands, especially in the last trimester or in your late advanced pregnancy, please do not assume it. Do not ignore it. Just go to your healthcare provider. Thoughts of self-destruction or baby destruction. If you're a mother and you have been pregnant and all you're having in your head is, I want to kill myself. I don't feel like it. I want to get rid of this baby. Please rush to the hospital. You could be developing depression at that moment and it is not safe for you and the baby. If you're constantly having shortness of breath or difficulty in breathing, please go to your healthcare provider. Dizziness and fainting. This could be as a result of very many things, and it is not something that you should take lightly. It could be something stretching from anemia, another thing stretching from preeclampsia, so please do not assume any dizziness or fainting. And sometimes you try to relieve it at home with water, with taking rest, and it's still there. Please do not wait for so long. Changes in your eyesight. It could be you are seeing blurry, you have temporary loss of sight. Please don't take these things for granted. They are signs that could lead to something that is probably much bigger than you think. Burning sensations during urination. It is not normal for you to have a burning sensation during you passing out the urine. So please do not assume it. Rush to your healthcare provider so that they can get you the right treatment that you deserve. And lastly, shoulder pain. Pain on one side of your abdomen and dizziness. This could be signs pointing to ectopic pregnancy or even sometimes rupturing of your uterus. Please do not assume these signs. Just rush to the hospital and get yourself checked up. It is better to be safe than sorry.